Oh my God. I hope you can see me now. I don't tire for this bad network. I don't tire. Dr. Israel, how far now? Hello. Can you hear me?
Oh my God.
Yeah, I'm back. I'm back. My network is messing me up, really. My network is messing me up. Let's see. Hello? Alpha,
I do.
can you hear me
Welcome
now?
back.
Yeah.
Yeah, I can hear you.
Network. Okay. Thank you. Welcome. Happy Sunday.
Same to you.
Okay. So I have family now.
They are fine.
Okay, good. Now I want to believe that our people they hear us, Abi. Waiting be the reason. Let me see. I want to be sure. I want to be sure that they can hear. If they can't hear us, then wow, good. Um, if you can hear us, just say yes. I can hear you. Oh yeah, let's go. Let's go. I want to be sure. I know you can hear me, Dr. Israel, but I can't see any comments again. So the matter now can't get a CB. Yes. Okay. Oh, Wahala be like bicycle. I can't see any comments. Okay, so what we're gonna do is what we're gonna do, Dr. Israel, I go exit. I go exit and boy you go. I don't know. I'm not seeing any comments. So the matter get as it be
Okay,
right now. Let me
make me
see.
ask if they
Okay,
hear
yes,
me.
I can hear you now. Okay. Okay, somebody say yes, I did hear
Okay.
you now. Okay, yes. Okay, good. So let's be fast because of time. We don't taste more. Somebody says, he say, my question is, it's happened to my colleague. He was experiencing a flow or emission of white slippery fluid from his penis, and we don't really know what could the issue with him. He was 25 by then and a celibate. He never knocked. Please, what could be the problem? Dr. Israel, beg, answer, beg.
They say 25 by then. Me say this person don't pass that 25 and maybe the thing there will stop. However, if it was happening, there was no problem. He just dey show say yes, the person can do things. And you may not you feel say he never knock, but in mind they think so many things. So when they think so many things, he can actually have those kind of uh ejaculation or those kind of fluid coming out from the body because of what and waiting they pass through in mind. Yeah, waiting they pass through in mind. Sometimes you may even have a word dream, maybe for night and all those things. So one, of course, of waiting they pass through in mind. So it's not something, not be one thing when you worry about. Not be one thing when they worry about. As far every other thing they normal, if you peace, no pain, there's no fever, no problem, not be problem. Dr. Fred.
Okay, yes. I hope you don't hear. Yes. Let me see if we have another question again. Watch both legs for almost half a year now. No gree go back. Please, what can I take for ringworm?
Okay, firstly, we not dey give person medication for year. So we're not going to even tell you, we not go fit tell you what you go take. But what I can advise is make you go hospital. Yeah. If you go hospital, they go check those ringworm. If you know you'll be ringworm when you think, maybe something different from ringworm, they go check and then they go give you the correct medication. Maybe you've not been getting the correct medication. I never can tell. They even ask to do some investigation. Maybe say now the investigation go come make them know the drug they go when they go give you. And another thing, if your hygiene level is low, please you need to increase them, because if not really ringworm still dey, because those things now like fungal infection, and if you know, if your parasitic and all of them infections. But if you know, if your immune system not, sorry I say if your hygiene is not too good, sometimes you start having all those many things. So you also need to watch your hygiene. You also need to wash your body. The towel where you they use for that leg, if you not use them for another part of your body, you also need to change some things. Maybe change your towel, change your soap, change your what you are using. Sometimes those things you may just need say now when you change one or two things, now they start to happen. Until you change them back, they may not stop. And so those are just some few things. But as far as you say, don't go hospital so that may you get the correct medication. Sorry, we don't give medication in this place. Dr. Fred.
Yeah, if they don't answer your question, you're gonna need to go hospital, make them check you. But most times, some people will get this ringworm. Now, them they treat themselves, and they never enter hospital. And then they will also want us to continue the treatment for them online. So you're gonna need to go hospital, and then give you medicine. Okay, ask your questions now. I want to believe that you did hear me, but if you know, so you know they hear, let us know. And does gastritis weaken sex performance? No, sir. No, now. Gastritis not the weaken performance now. No. But by the way, what do you even mean by weaken performance? Because many people get gastritis, they affect, there's no relationship, there's no correlation, connect at all. Unless maybe now your mind, when you do reason gastritis psychologically, now they make you know they feel perform, but they cause weaken performance, or maybe I don't know, Dr. Israel, they affect performance.
No, to the best of my knowledge is no. So except maybe you get some other medication when they take, or other things when they do, but no.
Okay, so you don't hear the answer. Yes, so maybe we see they wait for your question in case you just come, and this now Ask the Doctors program every Sunday by 8 p.m. to 9 p.m. Today, now question and answer we they do. So if you get question for us, drop out. But not be every day we do question and answer. But today's program, now question and answer. We won't answer your question because next week Sunday, we no go do question and answer. We go talk about topic. And we notice that whenever we talk for one topic, some people will they ask us question we know they related to that topic. Now make us say, okay, sometimes make we they do question and answer so that you can ask us anything we want to ask us. So use today's opportunity to ask us any question when you get. Ask now. No, they wait. Okay. I'm not seeing any question here. Sir, you didn't answer my question. No. Drop the question again. Drop them again quickly. Time not there. Let me see. Time not there. I know see you for YouTube again. And those we not get time. Yeah, drop and now. As it hot. I see you, Epic Tales. I see you, especially Alpha. How you day? Good evening. Okay, well, nobody they ask us questions. This the last question we get for here. They talk about gastritis and weakened performance, and we just told you there is no relationship. Gastritis, now the stomach area, the gastric mucosa, connects to your performance. Dr. Adrian mentioned something. Maybe you dey take medicine, maybe medicine wey you dey take, maybe na dey affect you or something else, but gastritis has no business with your performance. Doctor, sickness might not kill me, but anxiety. How can I do away with anxiety? Dr. Israel, you free respond to this?
Okay, anxiety, when it can become a problem, it's a sickness, it's a mental health disorder. Yeah, so it's a mental health disorder. The only way you can do away with anxiety is to visit a psychiatric doctor or a psychologist. So you guys will discuss. It will give you some. It will take you through some series of sessions on how you manage your anxiety. So one of it now, it will teach you how to take deep breaths. That will also help you to calm your nerves, calm your brain, calm you down. So when you see something when it's supposed to make you anxious, you take a deep breath, breathe in, breathe out. You can even breathe in and count 1 to 10 or count to as many numbers you can count. Then you breathe out. If you do that for some time, severally, that anxious attack at that moment can actually come down. So, as I said, anxiety becomes a problem when it disturb your daily activity, because normally everybody they anxious at one point in time. Everybody get that. But now when it comes to problem, when we say it disturb your daily activity or it disturb your work, what you supposed to do, then it becomes a problem. And when it don't become that kind of problem, it may say you need to now see a psychiatrist or a psychologist, so that may they take you through some process. Another process now be the if now maybe now something that they make you the day anxious, you need to give yourself positive affirmation against or about that thing. So that make that fear for come out, because anxiety go with phobia and all that, so that fear will come out with those positive affirmation, with the breathing practices, all those things. Those tools now, two things when go help you reduce your anxiety. However, you need to see a psychologist or a psychiatrist. Thank you.
Thank you so much,
Dr. Fred.
Israel. Can you hear me?
Yes, I can hear you.
Okay, good evening. Yes. Okay, like if the woman gets belle, the child go die in her womb. This thing happened like 3 times. As doctor, wetin fit dey cause that kind thing? I'll allow Dr. Israel answer you, abeg. Oh yeah, Dr. Israel, abeg. He say, talking about IUF.
This question don't first day up. I able to say this question first day up. I think say you don't answer already.
So okay. The first one he asked, no, like this he asked him. He said the woman born and the pikin die after the woman born. He don't always. Now he say the pikin dey cry inside the belle.
Okay, now almost the same thing. Because if the pikin don't dey form already and can't die, they can't born and you turn stillbirth. Now still almost the same thing. But firstly, the first question will come be which time for the pregnancy the pikin take dey go. Is it the first trimester? Is it the second trimester? Is it the last trimester? Most of the time, if not death during the first trimester, when your blood is not miscarried, those don't feel be chromosomal issues. The body notice say this pregnancy not the form where it go remove them. Then if now the second trimester or even the third trimester, sometimes if the cervix not go hold the pregnancy, it go come out. Yeah, the thing feel there. Another one, sometimes if it be say the woman gets malaria fit cause am. If it be say it gets some infection for inside body, it fit cause am. Then the most commonest one, the one we can be another problem. Now, what will be the blood group and genotype of the woman? If the person get blood group O, A, B or B, I can't carry that sign when they call negative. It will not be positive. So if resource is resource negative. So that kind of woman now go they get all this kind of pikin. He get belle, pikin there. He get belle mostly when the pregnancy don't go far, don't almost reach third trimester, don't almost one borner. So that one and when that one they quick happen. And another one are just that nobody knows. It just happened. Yeah, it just happened. Then another one are some kind of medications when people they take during pregnancy. Some go take so many different kind of concussions, some go take some kind and drugs when maybe nasty doctor or maybe they see go buy them for pharmacy when they take when they're not supposed to take during pregnancy. So when you take some medications when you are not supposed to take during pregnancy, if it cause if it make the pikin come out, or if it make the pikin for inside belly because of those medications. And as I said, one of the major one is the resox factor, and which will actually cause that. So that when the pikin come out, you can't say now some go you just if you see yourself, you'll be amazed and you will not be happy to see such thing. So for that kind of person, you need to get a gynecologist. You need to get doctor when they specialize in women, when they treat women. You need to get one when it go follow this course. They go do some investigation for round, check a womb, check a blood type, check everything, try to understand even your moon, check everything. Then they go start to the monitor. If na resource wahala, they know what they go do when go stop am. If now maybe the woman I go take medication we're not supposed to take, they go also know and try to correct her. If any other thing, they go know. If not the one where we say we go they wait to the pray, say nothing go, all of us go they wait. Why some they go need to bring out the baby even before the time when they notice say once the pikin reach so time and the pikin take the back for belly, they go make sure say they bring out the baby before it gets to that time, so that made the pikin for no buy. Yeah, made the pikin for not buy. Yeah, that's say you said on the last trimester. So made the pikin for not buy. So now so it they be. And so it they be. Dr. Fred.
Yeah, thank you. I hope you can
Dr.
hear me,
Fred.
right?
Yeah, I can hear
hope
you.
Hear me. Okay, good. Somebody says,
yes.
Is there any effect that can come with abstinence from sex for a long period of time, since the process of spermatogenesis is active daily and maximally producing 203 million cells each day? So the effect is that your body will take care of all those productions, you understand? And through the process of what we call apoptosis, since they use spermatogenesis for us, we also do small distance. So your body will take care of that. There is no effect at all. Yes, we have seen researches and it's ongoing that says as a man, you would benefit more if you ejaculate more frequently, 21 times. Studies still going on, but it's not yet conclusive. You will benefit, you would reduce your risk and the whole stuff. But that does not mean that if you don't engage in intercourse, then you will come down with sickness. No. No, you're not there. Dr. Israel, you want to add anything to that?
Okay, the question when I want to ask, when you know when person they grow they come, yeah, when person they grow they come, and when you start to they mature, all those things start to they form, all those spermatozoa and all those things start to they form. As at that age, 15, 16, 17, some people never knock and they go take them like 4, 5, 6 years or 7 years before they even think nothing has happened to them. So nothing will happen. Yeah. As Dr. Fred talk, the body always know how to take care of things. So it will also take care of it.
Thank you. We have a question here. I have a prostate cancer patient whose testicles have been removed. and is still on bicalutamide and some other medication. He's skeptical about taking chemotherapy drugs because of the risk. He says what there is also another drug the doctor recommended, though very costly. I don't know the name of the drug. Do you think it's safer and maybe more effective than chemotherapy? The patient is largely stable. Look, I allow Dr. Israel respond, I beg.
Okay, Dr. Fred, you dey hear me?
Yes, I can hear you. Yes, I can hear you. I can hear
Yeah, we
you.
know how chemo does this work. Okay, we know how chemo does this work, how chemo to the react and how chemo to the work. Now, I think it is very good, and it is very important for.
I can't hear Dr. Israel. Am I the only one? Hear Dr. Israel. Okay, yes. Dr. Israel don't come out. I thought as much. Okay, so your question is about, first of all, the patient is stable, the patient is on medication, and now for recommendation of the chemotherapy, what are they trying to achieve? What was the stage of the prostate cancer? Remember, uh if it was at the early stage, maybe the stage one, it has not metastasized, and they took it out, you can make a decision. If it has metastasized and they are thinking or they are suspecting, they might also recommend chemotherapy. Yes, we know some of the side effects of chemotherapy. However, the decision to go for chemo or not to go for chemo, I can't really make that decision. I can't say because we don't have more details. But most times, the doctor might want to prescribe that because they are also thinking of maybe there where or there are metastases. So they're trying to, okay, it's back. They're trying to go after it. Dr. Israel, oh yeah, yeah, welcome back. Hello.
Yeah, I'm with you. Did they hear me?
Yeah, yeah, go ahead, go ahead.
Okay, so as I was saying, I was like, people, we know how chemotherapy take dey work, how it take dey react, and how it take dey damage a lot of cells in the body. But we also know what cancer can do to the body. So I think uh, even those medication when you say that they give and if you look at very well, you will be surprised that they have some element of chemotherapy inside them. So I think the best thing for that patient, now that he's still very stable and strong, now that he's still very stable and strong, I think it is better for him to go for the chemotherapy now that he's still strong. Because if he don't dey weak, he can't go. If he become something else. But now that he's still strong, that he can still do so many things, I think it is better for him to go for the chemotherapy so that make everything for comot immediately. Now they did the surgery to remove large amount of to remove a lot of the issue. So the chemotherapy is to clean the rest. Is to clean the rest. I know say when they do that, the reason why they do that they remove the testes and because when you produce sperm, you can't go stay for the prostate and all that. So then we want to make all those process stop. And that's drug what they give and to also make sure say all those process stop. But the cancerous cells, that those chemotherapy now will take care of them. Yeah. So he need as far the he still there within that process. He never, I hope he still there within that process. He never go the stage is never too go far. A better make you take care of am now with the chemo so that it will be fine. It will be completely fine. Because once he don't pass as be careful, he may not be able to do anything. Dr. Fred.
Okay, I believe you heard Epic Tales. I hope you heard the response from Dr. Israel, and you saw his own take. Before he came up, I gave also my own take. Uh-huh. So I hope you can now make a decision. In addition, you should be discussing with your doctor as well. And the doctor should also carry you along. They should explain the reasons why they are also thinking or introducing the chemotherapy. These things are not hidden. You can have this discussion with your doctor. Very important. Um, okay, if person they complain, say im manhood no dey function proper, when he dey with him wife, but he dey function proper when he dey with another lady, wetin fit cause that kind one? No vex on my question, abeg. No, I no vex. I no vex. I no fit vex. Okay, no be bad question you ask. Oh. Now, for normal life, e get wetin we dey call see finish. I'm using see finish so that you can relate with. But also, you are now used to your wife. You are used to your wife. Your wife know they make your brain spark, scatter. Eh? You don't dey oversensitize. You don't see and every day. But the one wey dey outside, you never see am before. You no know am. That part of your physiological response is still new to that one. So your body is seeing that like a stranger. This one is a part of you. So as now a part of you, it will now need you to do more work to arouse. It no mean say you dey sick. It no mean say you get problem. But now what they call is like you are physiologically oversensitized. You don't see your woman back to back. But the one way the outside, where you never see, that one, a part of your brain has not been sensitized. Now they make you they feel like say your manhood they respond. You get my point. It's not a sickness, it's a normal process, and you have to now work on yourself. Because if every time you they follow different women, by the time you follow that new one outside, after you go see that one finish, you go they oversensitized, you go meet another one. How many you want they meet? Do you get my point? So it's not an excuse for you to they make your manhood they stand up and down, but also it doesn't mean that you have a problem. This now means you have to work on yourself psychologically. So if you want to add anything to that?
No, you don't already talk the part when everyone the psychological part. So you don't already talk. So you need to work on yourself psychologically. So there's nothing else.
Yeah, it's important. Yeah. And because now that psychological part will come put you for trouble. You get the point. If you don't control the psychological parts, now that one will come put you for problem. The other ones no go put you for trouble. You know me say you dey sick, no. But if you know if you control these mental parts, I cannot lie you, problem will happen to you. Okay. And this is a very good question, by the way. You know me say you get problem, and a lot of men don't go through this. So nobody go laugh you for asking this question. Yep. Okay, let's see. Do we have any more comments? We are almost out of time. Is it clear to you, sir? Do you understand? Please make me know that you got all our responses. Oh yeah. No time. If you never shared this video, I wonder why. What are you waiting for? Why haven't you shared? And why haven't you shared? Yeah, it's like now me they enjoy this life pass. So my brother, now so you be. Everybody they observe you, they don't want to ask. The moment we are done with the live session, you start hearing, Doctor, please now answer me. Doctor, I want to call you. They don't make good use of this time. And the truth is that we don't get time to follow everybody chats online. We don't get that time. And I make us they make out these live sessions to respond to people. So keep asking us and we'll respond until 9 p.m. So Israel, you get anything to drop for this program? Anything at all?
Not really. I want to just for today. We know say our network actually we want give us small hinge, and but we are glad say we still fit do the program very well. So make I think everybody should just take care of themselves. And if you notice the weather is very, I don't know for whether not everywhere, but for those of us when they stay Lagos, you notice that the weather is very hot this period. Uh, so I beg more try to dey take a lot of fluid this period. As Dr. Fred talk, so many questions when people will need to ask. If you this is the best time to ask. This is the best time to ask because it's get the time when you go you get some question where we go even see for our WhatsApp or sorry for our Facebook page. So make we just
Okay. Dr. Israel network, like I say, network don't start to the act up. I don't know what happened. But before we go, um, I need you to share this video. Share this video. Share the live session. Doctor, is it possible for somebody to develop prostate cancer at a young age? Okay, it's possible. It's possible, honestly, it's possible, but it's not common. It's not common. Prostate cancer is actually common in elderly men. So if a young man they complain about prostate issues, nobody go they think of prostate cancer because they common at all for young men. But that does not mean it can't happen. If it happen, uh but they common at all. Now people with the elderly, now they get prostate cancer more. So if young man they get prostate issues, we know the first of all think of prostate cancer. Thank you so much. I will try to convince him to go for the chemo. I hope he obliges. Yes, yes, yes. Okay. Doctor, please. Oh, I used to masturbate. I used to masturbate during my young age before I later realized what I'm doing. Due to the constant rubbing, my manhood, then I noticed it has cost it small. It has what? Cost what? I don't understand. It has made your manhood to be small. Is that what you are saying? Please, any solution? I'm now ashamed of the size I get now. Make I allow my Oga respond to you. Oh. I want to assume he understands your comment. Dr. Israel, I beg.
I'm not sure understand again. It say it's more and well, I don't think that can cause that for you. Yeah. I'm not sure say because of what you do, it go fit cause your size to come small. And it's not possible. I think that are your physique, that one are you. And also I need you to understand this. It's not about the size, it's about how you take use them. Eh? That's what matters. So it's not about the size. Some people get on like 22 inches or 30 inches. They're not if you use and do anything. It's just big for nothing. While some people get on small, but once they start, you'll be like say the word won't come down. So the most important thing is how do you use it. It's not the size that matters all the time. And also make sure say if your partner not they complain, I don't see any reason why you should be complaining. Yeah, if your partner they complain, you should not complain. Uh, so I think first of all, you need to build that confidence in yourself and build that confidence in your guy. When you don't build that confidence for yourself and for her, he himself will come start to dey work like who he suppose be. So no body shame am, no body shame am, leave the guy as he be. And as I said, that is not the reason. It's not because you first of all do those things. It's not, that's not it. Not because the size. Dr. Fred.
Thank you so much, Dr. Israel, for this response. Thank you. Now it might be one talk with that, but just to save my energy. So maybe we try a round up, I don't know that you get any final comments for our people as they watch us right now.
The same one question. I don't understand that. Moses Freeman.
It's just the answer right now. I'm just seeing it now. It says, good evening. Sorry. I want to ask you the question, please. If someone mistakenly his blockers and the blockers, and the blockers is paying the person and also swallow, which kind of job? I know. Okay, Dr. Israel. I don't know this one. No.
Okay, heat is blockers and the blockers is pain the person, and also swollen is swell up, which can Oga, carry yourself. I never read and finish person before.
Okay, swollen.
Okay, firstly,
and
let's
also swollen. Okay,
swollen, yes. Let's assume that Moses B. Freeman, let's assume say you know they follow us or you never enter our life before. One of our rule is that we don't give medication to anybody in social media. If you need medication, go and meet your doctor. Go to the hospital. So if your blocker swear and they pay you, and you see that for us, now me say e no dey pay you. If your blocker swear and they pay you and they ask for drug online, it simply means say e no dey pay you, because you cannot have that kind of complaint and be sitting at home. Person will get that kind of complaint. If he slap person, based on what they even teach us about blockers, they pay you. So I will advise you, except maybe the pain not severe, I will advise you to go to the hospital, because you never can tell what they make and they swear. They feel not because you hit them. It will be something else. So you need to go to the hospital, make they examine her, make they see the swelling, make they understand what they cause the swelling, and then they go know if na medication you need or if na something else now you need. So I also want to use this opportunity to tell you and every other person that going online, coming to social media and be looking for medication is not the right thing to do. And it's not every medication you see online or you see in social media that you go and be looking for how to get it and start taking it. So I mean, you not cause problem for yourself. Yeah. And there are so many things, there are even some when you see online, those things never even manifest 100%. Like those medication feel never even do like that. Or even though it did, it never really, then the country never really say make they start to use them like that. Well. So make we dey guided, make we dey very guided on things when we dey see online, because so many people don't take so many things online and they know wetin they pass through. Not be my mouth for here, and they know wetin they pass through. So if you dey take and you dey get luck, one day you may not have luck. So time don't finish. So I'll just say thank you, everybody. Thank you, those of you who ask question. Thank you so much. And those of you who they follow us, thank you so much. Thank you for following, and thank you for listening to our live. Those of you where they send us messages, yes, there are some questions you send. It's not like we don't feel like answering them, because those questions are questions that it seems like, oh, this person really need to know. However, because of time, we may not be able to consider that, because with already say if we answer, you will send another one, so there's no need. So what you can do is to go to the hospital or what you can do is to watch our videos. When you watch our videos, sometimes your question can actually be one of our video, or your question if you don't answer for one of our videos. So we're there. From that one, you'd already get your answer. Dr. Fred.
Yeah, thank you so much, Dr. Israel. Thank you for watching this program now every Sunday by 8 p.m. to 9 p.m. Share this video. No come late. If you come late, you go miss. Invite your friends and your loved ones, and make sure say all the advice we they give, you follow them. We'll go see you next week Sunday on this same platform. Like I always say, good life now waiting. Good life. Now sense. Take care and have a wonderful night. Bye-bye.